5 minutes to live. This summer, someone will die every minute from drowning.
That's right. Remember this woman who became submerged underwater, and her 5-year-old came to the rescue, pulling her from the pool and saving her life. But if it happened to someone you know, would you actually know what to do? Fox News Medical A-Team's Dr. Mark Siegel live from South Nassau Community's Hospital with the life or death decisions that can make all of the difference. Good morning, doctor.
Good morning, Abby. Good morning, Jackie. It's actually the #1 cause of unintentional death in children 1 to 4. So everybody pay attention to this. We're at South Nassau's Community Hospital. Right outside this wall here is Baywater. We're right on Long Island's beaches. This is where drowning is occurring. And today, we're honored to be joined by Dr. Joshua Kugler, who's the chairman of emergency services here. He's also a former physician for military special ops, and he sees a lot of drowning and a lot of drowning victims. Welcome, Josh.
Good morning. Thanks for having me, Dr. Siegel. It's great to be here.
Tell me something. What do you do first when you come on the scene? Even if you're not a physician, what do you do at the beach, at the pool, if you see somebody that's submerged?
That's a wonderful question. As we come upon the summer months, we're going to see some drowning victims both at the pool side and at the beach side. Most importantly, we stay calm and we make sure the scene is safe. So the most important thing we can do as someone who's going to potentially rescue somebody is make sure that they're safe and they have what they need so they don't become another victim.
How do you make sure they're breathing properly?
So when you come upon the victim, the first thing you want to do is you want to assess the victim and you want to open their airway if their airway is not open. You want to look at the patient. If their chest wall is moving and they're breathing or air is coming out, we want to put them in a position, a rescue position, which is usually on their side. But most importantly, again, is their airway. If you're going to remember one thing this morning, when someone has a drowning or a submersion injury, is to open their airway. And what we do is we simply thrust the jaw open, and that in and of itself will relieve the tongue off the back of the throat and allow the person to breathe.
Now you're taken to the hospital. On the way to the hospital, in the ambulance, what can you do?
So ambulance personnel are trained at very different levels. There's basic life support and advanced life support. At the very basic level, they'll support the breathing of the patient to continue to help them bridge them to the hospital. At the advanced life support level, we have very sophisticated machinery now in Nassau County, one of which is a BiPAP machine or a CPAP machine. That stands for continuous positive airway pressure. The lungs, when they get filled with water, it's very difficult for the air sacs to exchange oxygen, which is what we need for our organs. So this machine can actually push the fluid away and allow the air sacs to exchange that oxygen. And they have this on those ambulances.
Now you're in the hospital. Now he's in the hospital, where I understand that more than half the time serious complications ensue, brain damage, even death. What can you do in the hospital, as your role as head of emergency medicine, to stabilize the patient and get a better outcome?
Certainly. So as we get into the hospital and the continuum of care continues, the patient obviously is changing. Their respiratory status may be getting more compromised. As we know, time is not on our side when it comes to fluid building in the lungs. We need to relieve that fluid. So we have more sophisticated tools. We may use the BiPAP machine and bridge them if in fact they're breathing, but if their breathing becomes more labored, we can then do something more definitive like intubation, where we put a definitive airway in. We have a fiber optic intubation piece of equipment here. It's very neat. We're going to have them open their mouth, and we can see right down into their airway and pass the tube and breathe for them as we put them at ease.
A lot of time with heart problems as well, right? Rhythm problems?
Absolutely. So we see a lot of these same modalities, these same tools being used for people who have heart failure, which is a similar phenomenon with fluid on their lungs. In addition to people with arrhythmias, anybody whose heart has stopped, we will provide a definitive airway for anybody who's in cardiac arrest.
Brain damage?
Brain damage, certainly ventilation or proper oxygenation to the brain is very important, so we will provide the definitive airway for that as well.
Dr. Kugler, if there's one thing you want to tell parents out there to keep their children safe, what would that be?
Well, the most important thing, I believe in this personally, is prevention. Make sure your children are safe around a pool area. Make sure the pool areas are safe. Cameras are in plenty supply. Please get one. But swimming lessons and comfort around the water.
Life jackets?
Life jackets are important, but they're not a substitute because they're not always available and a child may be curious. So please, waterproof your child by putting them in the water and not have them be afraid of the water.
Guys, back to you. This is very important information. Beaches over there, pools, regardless of where you're going, be very careful for your kids.
Dr. Siegel, I have a 4-year-old and a 7-month-old at home. My 4-year-old really resists going to any type of swimming lessons. I'm curious, at what point, what age should I be putting my child in swimming lessons? I think we started at like 1.5 with her. I have a 7-month-old. Should I be getting her in a pool with me and getting her used to that water?
That's a great question. They want to know when you should start immersing your children in water or getting them trained. How young can you start this idea?
Right after birth. Literally right after birth, you can start to get your kids water trained. It's very easy. Kids are natural. We're all born in water, so we're natural swimmers, and we know how to breath hold. It's a very natural phenomenon. There's a reflex to hold your breath, so kids can actually do that at a very early age.
I want to tell you, my father dove into the deep end of the pool and saved my life at the age of 9 months. He was trained in the Navy, so I'll never forget that. Good to see you.
Pleasure. Thank you.